Can I see my presentation? Bring it down a little bit. Bring the camera down a little bit. Yeah, that's better. $6:30. Welcome to Dr. Dean Live. How are you guys? Hope you're doing good. It's freezing in New York. I got my scarf on, but they tell me it's not very fashionable. So I'll take it off. It's okay. Hope you're doing well. I hope you're nice and warm, cozy, wherever you are. Today, we're going to talk about associateships, how to be a great associate in a practice, how to buy your own practice, what to do at a dental school. A lot of us are burdened with a lot of expenses. Dental schools is very expensive. How do we take care of our loans? How do we get a job? We're going to talk about that. We have a lot of questions coming in. So I want to first start with saying, if you can't see the video and you can't see the presentation, you can go right now to www.zoom.us and put in the number 625-758-496. 625-758-496, so you can actually see the presentation. If you can't get to a computer, email me at the end of the program and I'll send you the PDF. It's important to have this information. I think it's a great piece of information for you. I spent a lot of time on this and I want everybody to get the right content. My email is drdean17@gmail.com. That's my cell number. You can text me, you can email me, whatever you need. I'm here for you to become your leader and your mentor in your dental profession. I want to thank AIC Wall Street putting this all together, FMR, NYU, and all the people collaborating together to bring this program to you. First and foremost, we are in New York Smile Institute. We're on Fifth Avenue. There's traffic, there's snow, it's horrible. I hope you're in a nice warm place. I want to live in Florida. Can I just come to Florida? Because this is crazy over here. But anyway, I want to thank all my doctors who work for me. We have a wonderful day today. Dr. Armin was here. Dr. Young was here. We had a great day today. So let's talk about what's going on. How do I become a great associate? Well, the first thing you got to figure out is, where do you want to live? Do you want to live in a big city, small city? Where do you want to live? It's a really important thing to make this decision. Why? Family comes first. Your livelihood is going to come second. And where you're going to be, your reputation, where you're going to grow up, where you're going to grow up your practice to become the leader in your profession. I take average dentists and I make them superstars. I take superstar dentists and I make them rock stars. To me, it's about education. So you got to figure out, where do you want to live first? Where do you want to start your reputation? Wherever that's going to be. What kind of dentistry do you want to do? And this is not a judgment point. This is just your perspective of what kind of dentistry do you want to do? High quality, medium quality, volume dentistry. You want to be a business owner? Do you want to make $1 million? It's fine. In dentistry, anything is possible. My path has been to be the best possible dentist I could be. That was my vision. It didn't matter how much money I made. I wanted to be the best. So you have to figure that out. That's personal, and it's no judgment. You just tell me, Doc, I want to make $1 million in 3 years. I'll show you how to do that. Say, I want to be the best dentist in my county. I'll show you how to do that. It's all about figuring out where you want to go. Should I join a DSO or private practice? Well, that comes back down to what is your goals? Is your goals to pay back your loans and that's it? Is your goals to make a difference in dentistry? Is your goals education? You have, it's very personal for anybody. Dentistry is a very wonderful field. We have the wonderful opportunity to make and choose our destiny. Let me tell you something. I am so happy to be a dentist. You should be so grateful you're in dentistry, because 25 years ago, I was in the back seat because the doctors thought we were just dentists. We weren't doctors. Well, guess what? Today, we're in the driver's seat. And you have a very rare position in our lifetime, the next 10, 15 years, to make a choice of what you want to do in your profession. How do I pay off my debt and still keep my integrity? That's the big question. Well, I'm going to tell you that in a little bit. But on a side note, I want to tell you that if you figure out what you like, and if you figure out what kind of dentist you want to be, it's going to be very clear. DSO are serving a great population. There's nothing wrong with that. It's a section of the population that needs dentistry, and they're filling that void. But there's also different things. You want to get stuck into a DSO 5 days a week? You know, it depends on what you like. If you want no responsibility and you want to go to work and get a paycheck, that's a different type of person. That's great. If you want to build your own profession, maybe you work for the DSO for a little bit and then you kind of get out. So I'm always a big believer of no long-term contracts. DSO people, I respect you, but a dentist coming out of school should not have more than a 4 or 5 year contract, 3 years minimum. To me, it's like, just take with a 3 year contract. You don't know what's going to happen in 2 or 3 years. Things change. How do I keep learning? I'm going to show you that in a second. We have a 3-2-1 rule of associateships. You come out of dental school, you're 3 or 4 or 5 years out, 3-2-1 rule. 3 days a week, you got to make your money, wherever it's going to be. Clinic, associateship, DSO, you got to make your money, you got to pay your bills. That's 100% your priority. 2 days a week, you're going to find a really good dentist, a good dentist that wants to help you, that wants to mentor you, that's actually willing to teach you, right? Somebody who's really going to take care of you. That's a hard thing to find. It may take you a couple of years. Go to the organizational meetings. Go to the Greater New York Dental Meeting. I'm going to be there on Sunday giving a presentation at the Greater New York Dental Meeting. Go to your local dental study groups. Become involved in organized dentistry so that you can meet the person that you may want to be an associate with 1 or 2 days a week. So that gives you a quality of not just doing volume dentistry, but actually doing good dentistry and actually getting paid for it. So the 1 or 2 days at a private practice gives you a little bit more fulfillment, right? Because you're dealing with patients in an hour, not in 15 minutes, right? You're actually doing dentistry the right way. 1 day dedication. The 1 day is dedicated to learning. And this is what I tell all my doctors. I don't care if they've been out for 10 years. Keep the 1 day, Wednesday, Friday, Wednesday, Friday. Usually that's the day people have off. Take the 1 day and find your mentor. Go to a CE course. Go to somebody's office. The only way I learned to be a great dentist is to watch great dentists. You can't be a great dentist if you're watching average dentists. Think about that. You want to be in a situation where you can learn, grow, and start developing your field. Dentistry is a technical profession. If you don't get the technical experience, you want to do big cases and do beautiful smiles, you have to have the technology in your hands and your eyes and your brain. So that 1 day over the course of 4 or 5 years is going to allow you to increase your potential, increase your proficiency, and actually learn the techniques the right way. So the 3-2-1 rule for me, I did it when I was younger. I didn't know what I was doing, but it made a lot of sense. The doctors that taught me, that's what I've been doing for the last 20 years. To this day, I still have my one teaching day. I go teach on Fridays. We have a volunteer course, FMR at NYU. It's a teaching course. What do? I learn. That's my learning day. I go to certain meetings in August, in the middle of the summer. I go to learn. I keep learning because dentistry is like that. It's a lifelong commitment of a beautiful profession, and we can change a lot of lives. You have to find a mentor. If you want me to be a mentor, 100%. A lot of times you do these Dr. Dean live programs, I get 4 or 5 emails. There's 1,100, 1,200 dentists watching the video. I get 4 emails. Just reach out to me. Come to NYU. Spend a day in New York City. Spend a day. I challenge you to learn and to be part of our group of positive energy, being phenomenal at what you do and growing and learning, because that's really what it's about. You have to grow and learn slowly. It doesn't happen overnight. There's no quick fix in dentistry, ladies and gentlemen. I care about my professionals. There's no quick fix. You have to learn slowly. If you can't see this video, please understand, I will email you the PDF, but I want you to go to www.zoom.us right now and put in the numbers 625-758-496 so you can actually see the presentation, okay? 625-758-496. Let's take a look at your associates. How do you become a valuable associate to your dental practice? So you finally find the guy who's going to hire you. He's going to say, do my exams, do my fillings, do my cleanings, do my basic stuff. But how do you make yourself more valuable? You haven't found the guy. Until you find that person, what procedures can you do to actually help the practice? So the thing I tell my doctors, the first thing is implants, understanding implant technology. Digital designs, how to read a CT scan. There's a course for that. Take the course, how to read a CT scan. So when you go into the office to become the associate, you say, hey, Dr. X, I know how to actually read CT scans. Really? I don't know how to do that. I know how to scan. I know how to do root canal therapy with a digital a drill or a digital caliper or digital technology. So it gives you an insight to something different that the practice may not be doing. Invisalign. Become an Invisalign expert in that one day that you're learning. Anything you can bring to the practice makes you very valuable to that partner. And then he's going to look at you at a different position than the regular doctor who just wants a job and wants to make money. So how do you make yourself valuable? Do something different in the practice. Figure out what they don't need. Identify the needs of the practice. Find the areas that need to grow. Invisalign, digital technology, scanning, CT scanning, implants. Remember, most dentists are referring out their implants and their root canals and their specialty work. Well, maybe you can come in and do that. Maybe you can spend a year fellowship at FMR at NYU and become a full mouth rehabilitation specialist. Maybe you can take a weekend course and become a digital specialist or a digital smile design specialist, right? That's all connected. What do I love to do? And what can I spend that one day a week learning so I can become a specialist? So when I do find the right person, I'm in a different vantage point to teach them and to help you grow the practice. Let's shift over to how to buy a practice. But before I do that, I have a couple of questions. Dr. Dan is from, I'm 5 years out of school. I currently work in insurance-based practice. I don't feel fulfilled. I don't blame you. You're working hours a week. You're doing quick restorations. You're not really loving what you're doing. It's not really what you wanted to become. Well, again, if you're working 5 days in that practice, that's the wrong move. 3 days, 2 days, 1 day. It's got to be that proportion because then you'll always keep growing. You'll always keep learning. What's the number one course I should be taking? Well, you got to think about what you like. You like root canals? Take a root canal course. Do you like aesthetics? Take an aesthetics course. Aesthetic Advantage at NYU, to me, was the number one aesthetic veneer course that I found in the country. And I took it 3 levels, for level 1, level 2, level 3. And I was a prosthodontist 15 years. I was 15 years too late. Take it now. You're out of school 5 years. You got to make some money. You're kind of not really that busy. Take it now. Become a specialist now in aesthetics. Take our FMR course at NYU. There's a 4-day course in May coming up. We just had our 4-day course in October, very successful. We only take 25 doctors. Why? I don't want to teach 100 doctors. I want to teach 25 doctors really well and make them great. That's my philosophy of teaching. So you got to think about that. I want to get out of the rat race. Well, you got to figure out how to take courses that you really care about. That's another question here. How do I know the value of continuing education? That's a very good question. So think about this. You're going to sign up for a CE course, but you don't really know if it's going to be good or not. That could be a waste of money. I always like the 5-3-2 rule. 5 years, something's been out. FMR, Aesthetic Advantage, LVI, SPEAR continuing education, COIS continuing education. They've been around for a while. So something's been around for at least 5 years. A new course coming out, I'd be a little bit worried about. 3 of your friends have taken it. Don't be the first one to take a course, right? Don't be the first one to take it. Take a course that other people have taken and said, hey, I really highly recommend this. And 2 is there's at least 2 people that have taken the course and actually loved it and actually worked it and actually made it practical. Because you can have somebody who likes the course, but they never put it into practice, right? So you have a lot of education that's great, but I can't put it into practice. So that's a really critical part of education. Can I use it on Monday morning? The way we teach our course at FMR, 100% practical dentistry, easy dentistry, difficult dentistry, complicated dentistry. We do it as a practical acceptance to that. So let's go back to how do I buy a dental practice? I'm going to assume you've got to be at least 5 years. I would not buy a practice less than that because you're going to buy it and you're not going to really know and you're going to learn on the way and you're going to make a lot of mistakes. So to me, you got to be 5 years out minimum to understand dentistry. Now, if somebody says to you, Dr. Jones is retiring, he's 79 years old, and it's $1 million practice, That's a very big undertaking for a 5-year out dentist. I would really not suggest that. Doesn't mean it's impossible, but I wouldn't suggest that. I would suggest that Dr. Jones has a $400,000 practice or a $300,000 practice that you can take over slowly and turn that into $1 million practice. You want to be the growth of the practice. If you buy a practice that's already $1 million, it's very hard to grow that at a young age. They don't trust you. You're going to lose some patients. You really can't do the dentistry, and it becomes very uncomfortable. Buy it smaller and grow it. That's my first entrance strategy. I call this entrance strategy because you're entering the business world. You've done your dentistry, you've learned it a little bit, but now you're going into entrance strategy. You have to evaluate the practice. Now, you have to get a professional. You can call me up, you can call a broker up, you can call anybody who is in this business at least 10 years. Don't get a young evaluation person who's been out for 5 years. Get a person who's been in the practice for a long time and understands evaluating practices. What's the total collection of the practice? Not what he produced, what he collected. That's a big difference sometimes. I produced $1 million, but I collected 500. That's not good. I don't like that. I want to produce 500 and collect 480 or collect 450. Those numbers got to be really close. So you're paying a practice based on collections, not on production. Number one rule. How many ops for production are there in the room? Is there room to grow? I'll give you an example. A doctor's retiring. He's making $400,000 a year. He's got 2 operatories. I ask him, do you have a hygienist? Yes, I have a hygienist 3 days a week. So you're working one room 3 days a week. She's working the other room 3 days. Where am I going to work if I'm buying the practice? Not a good growth potential. The other scenario, I have 4 chairs. I'm doing $500,000. I'm slowing down to 3 days, and I got 4 chairs to work. Understand the math. Each chair is really potentially about $300,000 to $400,000. So a 4 operatory chair should be doing $1 million, $1.2 million, right? So that's the calculations of each chair. So if I'm going to buy a practice, I got to have at least 3 chairs, me, him, and the hygienist. A 2-chair practice, not good. Can't sell it. What do you do with those? They have good integrity. You bring them into a new location. So if you have a location with 7 operatories, you go get the guy who's doing $300,000 on a 2-chair operatory, bring him in. That's a great value. Why? Because their value is in their integrity. You never have to discount that. The older doctor that's working for 40 years has great patience, but how do we grow it in a 2-operatory office? I can't. I got to take him to a bigger office, move him out, treat him very, very good, and explode that practice. That's how you do it. Which procedures are being referred out? So I look at the procedures of how many procedures are being referred out. I look at implants. If $200,000 is being referred out in implants, or $100,000 are being referred out to endodontics, that's a lot of money. Can I do endo? Can I do implants? Well, I'm not really proficient in implants, but I can do the endo. So I can keep that kind of practice, or I can keep more of that. That's how you purchase the practice, to figure out what's being referred out and can I do it proficiently. You can't do endodontics if you're not proficient at it, right? I'm saying if you're proficient at it. I'm not saying just do the endo because to save money. That's not what I'm saying. I'm saying get good at it, get proficient at it, and then start implementing that into the practice. I always walk into a practice and I look and I talk to the staff. I look at the demeanor of the practice. Are they on their phones very negative? Or are they positive when I walk in? Are they saying hi to the other patients? I sit in the waiting room and I watch. And I watch them talk to people coming in. Oh, hi, Miss Jones. Yeah, sit down. We're going to take care of you. Or, hello, how are you? It's so good to see you. It's a very different demeanor. That's perceptual ability. As a dental professional, as a businessman, you have to have perceptual ability. Patient skills. Patient skills are very important to figure out, are you really seeing the people that you're seeing there? Entrance strategy. Is there a positive atmosphere in the office? Look for long-term employees. My first question again is, hi, Dr. Jones. How long has your staff been working for you? Oh, they've been only here for a year, 2 years. So there's nobody been here more than 5 years? No, they all left. Oh, really? That's an interesting point. Or on the other side, My staff manager, Yvonne, has been with me for 20 years. My hygienist, Amy, has been with me for 15 years. That's a good practice, right? You're evaluating the people in part of the practice. Anything you purchase with your financial gain, whatever you have, you want to purchase something that's positive, not something that's going to take you down the wrong road, right? So positive atmosphere is very important. I call that, and I got this from the ADA, had this on their website. It was a beautiful term. It's called the iceberg effect. You walk into the office, you want to purchase a practice, you want to grow that practice. You're only seeing 10% of the practice. You're seeing the top of the iceberg. There's a whole bunch of stuff down there that you don't see in the beginning. And that takes time. So what I like to do is spend the days in the office watching it. 1 or 2 or 3 or 4 sessions in the office watching what's going on before you purchase that practice. What are you going to see? If the doctor gets upset, if the doctor's doing beautiful dentistry, if the patients are happy, you're going to really be able to evaluate that just by watching for the whole day 4 or 5 times. You can only see 10% of that. The other point is, does the owner really want to sell? If I can tell you that a lot of dentists, they want to sell, but they don't want to let go. They want to sell their practice, but they don't want to let go. That's a bad emotional feeling. They're not really ready. So they have to be really ready to go, meaning transferring ownership immediately, right? And then the day one, you're the owner, right? When they say to you, well, you're going to buy me over 5 years, I don't know if I like that. Why don't I like that? Because when I buy you, I want to be the owner. I want to make the decisions. So they have to let go of that and become dentists, become employees, become workers. Treat them very good, because that's a very valuable tool. Make them happy. I make my associates and my doctors very, very happy. I make sure that they're working hard, they love the atmosphere, and I give them the best assistance. So they love the atmosphere. For the older dentist, he has to be feeling like a king. It's his last 5 years out. He should be treated like your father, right? It's not about taking over and then pushing him to the side. You have to take over the practice and then build him up, because he will promote you. If he's happy, the practice is going to survive. If the staff is happy, the practice is going to survive, and it's going to thrive probably up to 30-40% of whatever he was doing. If the doctor is not happy, it's a very different vibe. It's a very different emotional feeling. If he's not happy and he's telling his patients, this guy just took over the practice and he's not really doing the right thing, that's not what you want. So again, it's very important that he wants to sell. You're going to treat him very well, and the practice is going to really grow with you behind it. What's the status financially of the practice? So this becomes a legal battle. Can you get in there and figure out from a checking standpoint, of a financial standpoint, is this practice really thriving, or is the money being drained out for some personal reasons that we don't know? That's an issue. We have to kind of go in that as a lawyer, as an accountant, to figure out, is this practice working and paying the bills, or is there something else draining the practice, because that becomes a burden on you. This is probably the most important tip I can give you today. You need to meet the family of the doctor, the wife, the children. Has he been divorced? Has she been divorced? Is there multiple divorces? Is there multiple children? This is a problem. So I asked the question, how many patients do you have, Dr. Jones, that you don't charge anything for? Do you understand my question? How many patients do you not charge? Where is the no charge patient list, right? Because that's an issue. I want to know how many people I'm going to have to treat for free for the next 5 years. And again, if it's a normal setting, hey, divorce happens, it's okay. But is there a personality issue that you need to know about? Is there a partnership issue that you need to know about? It's a real problem, but it also has to be strategized for you to become a partner. We have another question. Scroll down. There's another question over here. Oh, should I specialize or should I stay in general dentistry? Well, that's a very personal question. Do you want to be the best at one specialty, or do you love doing everything? Now, you can't answer that question in your second year dental school or third year dental school. You're going to answer that question after your residency, because you're going to go to 4 years of dental school. You're going to go to your residency 1 or 2 years, and then you're going to make that decision right around maybe 6 or 7 or maybe a year before you graduate. Do I want to do one thing all the time for the rest of my life, or do I like doing different things? Do I really want to be the best specialist in this field? That's a personal question. So it's not about our success or not success. There's general dentists that are very successful. There's periodontists and prosthodontists and oral surgeons that are very successful. There's also general dentists that aren't successful, right? What is success? Success is a relative term. Is it money? Is it how many patients do I have? The success has to do with, am I happy? Am I happy doing my dentistry every day? I love doing dentistry every day, right? Because I've chosen something that I really, really love. The things I don't like to do, I don't want to do them. Now, it takes some time to get to that point, but you're going to specialize. If you find a mentor, if you find an inclination that you really want to be a specialist, then definitely go for it. I'll never deter anybody from being a specialist. If they have that conviction, I never deter them. I actually enforce it, because if they have the conviction now, they're going to have it later. It's going to probably grow, and it's a beautiful thing. How do I get bigger cases? Thank you, whoever said that. Well, the first question I ask you is, have you taken the courses? Are you ready for the big case? Can you prep 12 teeth tomorrow? If the patient gave you a credit card, could you sit down and prep 12 teeth and make them look perfect? All right. So my first question is, are you proficient in the big case? If you're proficient in the big case, you should be really confident. If you're really confident, which has to do with education, because you've done it 20 times, then it's proficiency, it's confidence, which usually sells the case. Selling the case has to do with confidence. Like, I know I can deliver that, as opposed to, I've never done it before. Can I just get a big case, right? It's very different if you've done 2 or 3. So if you're expecting to get big cases at a young age because you haven't done enough, I think it's going to be hard. What's my suggestion? My suggestion is you take the CE courses for what big case you want to do. If you want to do veneer cases, take the veneer courses. Take the actual practical efficiency, proficiency veneer courses. If you want to do full mouth rehabilitation, you're going to come take our course. That's a more comprehensive course, not just veneers. It's implants, it's aesthetics, it's occlusion. It's connected all together. So you got to get the confidence, you got to get proficient before you can do a big case and sell a big case. Now, if you're in an office that has the senior doctor is doing the big cases, that's great, right? In our office, I'll start a case, but I let my young associate go ahead and finish it. I want him to get that experience. You have to have a senior dentist that is willing to do that, that doesn't have an ego, that's ready to teach, right? So doing a big case is not just about getting paid, it's about doing it. So what I suggest to a couple of doctors and some of my friends, I said, listen, you've been out for 5 years. You've only done 4 or 5 veneer cases. Why don't you do a pro bono case? They're like, what do you mean pro bono? Why don't you do a pro bono case for, like, I don't know, a hairdresser or a photographer? What is that going to do? Well, it's going to get you to be more proficient with a really, really cool case. The patient is going to talk about you. That becomes an investment forever. Think about that. In my early years, I did a couple of pro bono cases for the right people. That became a great advertising for me. That patient, to this day, 20 years later, is talking about me. It also made me more confident and more proficient that I could deliver that kind of work. So that's what I say about bigger cases. Not about how do I get more people to say yes. It's how do you get your confidence to be higher? Because if you have confidence, you look at a case and you can do it, that's confidence. What's my other question? No other questions? What CE should I take after dental school, 3 years out or 5 years out? I'll give you a couple of websites that I would go to. Dental XP, great website, all right? A lot of information there. Sometimes it's a little bit too deep, but it's a good start. Dental Town, a lot of information there, maybe too much information there, but there's good CE there. I would look at NYU's CE calendar. There's aesthetics, there's full mouth rehabilitation, there's implants. Great education at NYU. U of Penn has a great program for education. Down at Nova in Florida, if you're down in Florida, take that CE course. So I would take some basic CE courses the first couple of years out. Use your Wednesday or Friday to learn from different individuals. And as you get more proficient in whatever you want to seek for, you can go look for that. You can really type in today, bone grafting materials and go ahead and get a CE course for that. But like I said, use the 5-3-2 rule. Something's been out at least 5 years. 3 of your friends have gone to it, and at least you have 2 or 3 confirmations that it's a great course. Let's talk a little bit about what is a digital office. For those of you who've been practicing for 5 or 10 years, You're in a certain office. How do you get that office digitized? Well, the first thing I want to tell you is surfcd.com. Surfcd.com has taken my office, which was a little bit digital, to super digital. So it's not just having a scanner, it's not just having a CT scan, it's how to put it all together. So the connectivity of the servers, the front desk, and all the operatories being connected that way is really an IT problem. It's not a dental problem. So once you have the resources to do that, I've slowly built my practice into a digital office because I did it slowly. I didn't do it all at once. Now, if you're building a new office, you want to get it all done in the beginning. But if you have an office that's existing, you want to put the pieces in slowly and then start connecting them. Definitely a scanner, definitely a CT scan, definitely a printer, a small laptop printer, and definitely the office manager has got to be integrated into the offices because that makes it very powerful. So digital dentistry has really saved us time and energy to bring an experience to the patient, right? Think about it. The patient's coming in as a new patient looking for a new dentist, and whatever you got that patient from, you may have gotten them from online, you may have gotten them from a friend. They want to come into an experience, a digital experience that feels a lot like a dental office, but like a spa or like a beautiful area that they feel comfortable. And it doesn't have to be large, right? It doesn't have to be a big office. It has to be a nice looking office. It has to be a clean office. The bathroom should be perfect. Every bathroom in dentistry should be immaculate, and there should be one person designated to clean that bathroom, right? It's got to be clean. The bathroom is the most important thing for your patient. Totally spotless every day. After somebody goes into it, make sure somebody goes in and cleans it. It's got to be a beautiful, digital, clean office, all right? And then we're going to try to connect those pieces together through the digital connectivity, and SurfCD does this all the time. Please send your questions to, where are they sending the questions to? Okay, send your questions. Email your questions. This is what I don't want to see. So somebody wants to tell me what their office looks like. It should not look like that in 2018. You need an upgrade. Spend a couple of bucks. You got to get an upgrade. And those little charts on the side, I'll put a little highlight on them. There's a little charts on the side. You got to get rid of the charts. You got to put everything digital over time. You can't do it tomorrow. Do it next year. Just get it all done. We don't want to see this. Just don't ever let your patients see this. Plaster in the laboratory. For CT scan technology, my recommendation is right now, all the CT scans today, if you went to the Greater New York Dental Meeting and you bought a CT scan, you're going to get a high quality CT scan. Now, some of you may want to save a couple of $1,000s and get a low volume CT scan. I don't recommend that. I want the highest volume possible. I want to be able to see everything. Now, there's a legal contingency on the CT scan saying if you have a CT scan and you're taking the whole skull, then you better be able to diagnose it. Well, what did I do? I took my radiograph CE course on radiography. I took a second one. I took 2 courses in radiographic analysis of CT scans. You got to take the course to get better so that you're proficient. The last thing I want to do is take a half of a CT scan and not see the joint and not see the jaw and not see the bone matrix. That's silly. To save $10,000 doesn't make sense to me. So we got the full scan to be able to see the patient, give them analysis of what they have, and then be able to treatment plan for the implant. What are the benefits that we see here at our institute? What are the things that we like to teach? Patient experience. When they come in, it's a different type of experience. Why? First of all, it doesn't smell like a dental office. There's no eugenol in the office. Candles are burning everywhere. It's a nice feel. The staff is positive. The person comes off and opens up the door and they come off the elevator. There's a positive feeling for me immediately. The staff is trained. Oh, by the way, your staff has to be trained. There's training courses for staff. It's called customer service. They need to take care of that customer coming through the door. It's a very different experience. Accuracy and quality control. In dentistry, we're working in microns. It's a very difficult world. It's a very difficult field to be able to deal with dentistry at a micron level. So how do I make the accuracy there? We have constant quality control checks, radiographs, CT scans. I'm checking with my loops. If anybody is practicing dentistry without loops, we already have a problem. You can't see the teeth without magnification. So my first recommendation is go get magnification. You can't see what you're doing. You can't see the margins, you're never going to make a margin that's correct. So to me, you got to get that and make sure the accuracy there. Same day dentistry, we did it for about 10 years. We did CEREC, we did E4D. It was a wonderful tool. The issue today for us was that 2-hour appointment is too long now. Now, wherever you are in the world, in the country, and you want to do same day dentistry, I think it's fabulous. It made us a lot of production, and it got patients very happy because they never had to come back. So for same day dentistry, I'm 100% advocate. I just don't do it today because my systems have changed. But if you're starting your practice and you put same day dentistry in, that's going to be a big increase in your production because you're doing one-day dentistry. So I am 100% advocate of that. I'm also looking at time. I'm constantly looking at the digital workflow from an implant to a tooth to an aesthetic anterior veneer to a bite plate. How do I tweak the time so that the time becomes not 2 or 3, 4 hours or 2 or 3, 4 weeks, but 5 minutes, 10 minutes, 20 minutes? How do I get the time slot to be created in a slow? And digital really has done that for us. So I'll give you my new tip on digital mock-up. We're doing photographs, we're doing smile designs, we're doing emailing that to the laboratory and getting mock-ups within an hour, 2-hour period. That's the next phase. You're going to see smile mock-ups in the next year being very streamlined into less than 1 or 2 hours. To me, right now, that's my priority. I want to be able to do that in 1 or 2 hours immediately. So that, again, is a time factor to change the time sequence. Final results and making things easier. That's what we like to do to our patients. We let them know that your protocol for making your implant from start to finish is easier. It's much more predictable. Why? We figured out all the pieces to actually make it work. Where do you get new patients from? The question is always, where do we get new patients from? So I believe in the bigger the net that you have, the better it's going to be. We have a university setting. We have the doctor himself. We have the staff that has bonus incentives. We have restaurants. You're going to your cleaners. You're going to wherever you live in the area or the apartment building you're living in. You have to let people know what you do. And when people ask you, what do? I don't say I'm a dentist. You know what I say? I change people's lives. I say, what? You're a coach? I go, no, I change people's lives. And on your phone, and all of you have a phone, put your best befores and afters and say, this is what I do. This is what I do. I change people's lives. I change people's smiles, and inadvertently, I change their lives. Oh, so you're a cosmetic dentist. I go, no, I change people's lives. That's a very different position, right? I'm not a dentist. I change people's lives. I constantly say that. Why? Because it's true, right? You change a person's smile, you change a person's bite, you change their occlusion. They're a different person, and they thank you for that. So whatever you can do to change that perception that I'm just a dentist. No, I'm a cosmetic dentist. I'm an implant specialist. I'm a root canal specialist. I'm an oral surgeon. I'm a specialist in oral care. Well, that's a new one, right? I'm not a dentist. I'm something different. And your card should say that. Take a look at your business card. John Doe, general dentistry. No, that's not what I do. Aesthetics, implants, rehabilitation dentistry. I do smile design dentistry. Whatever your passion is, you got to write it on your card. So you have to be able to promote that to the areas and the people that are in the area. Our digital technology has changed, right? So it's changing every 2 or 3 years. When a patient comes in to get a crown and we're scanning that patient, the first thing out of their mouth is, oh my God, what is this? This is incredible. I've never seen this before. Remember, we see digital technology every day. Most patients have not seen it. And the ones that see it are very, very impressed, right? So you're having something, a tool that's getting you faster into your impression system, but it's also making a big influence in your patients. So that becomes a very powerful tool for us. Preview imaging. So we'll do preview imaging for our patients and we'll say, hey, what do you think of that? They're in hygiene. This is a dental student. She's a wonderful dental student. She's got beautiful teeth. I said, Julia, take a look at your smile. She's like, oh my God, that looks amazing. I didn't think I had bad teeth. I said, you don't have bad teeth. We just wanted to make you a little bit better. This is my physical therapist, Andy. Just showing him what they could look like. That's a powerful tool. So imaging is very important. DSD is very important. Anything you can show them to have an emotional reaction becomes a very powerful tool. And then we get back to the red ocean, blue ocean. Some people have been talking about this for 5 years. I'm still talking about it. If you go to online and you put in Harvard Business Review, blue ocean, red ocean philosophy, it's something we talk about at ServCT, at AIC, how to create something different. Dr. Dean Live is a blue ocean undertaking. It's about changing the way we bring information to you. There's no financial understanding here. There's no about who's making money. It's about giving the doctors information clearly and honestly. And that's why I did this, because I wanted to have a forum that changes the way we teach education. The real way, from live patients, from live experiences. There's going to be people coming on the next 5 months. I can't even tell you that how wonderful these people have changed my life, because they're real people and they're teaching me the real rules of what's the reality of your future. And it can't be 2 or 3 years. It's got to be a long-term commitment to your profession. All right. So I really want you to understand that blue ocean, red ocean is really important. Your reputation is very important. You can't have a 20-year reputation and ruin it because you're going to charge the patient again of a crown you did 6 months ago because it broke. Right? Your reputation is very powerful. Steve Jobs had a 2.65 index. At 20 years old, he started Macintosh. At 30 years old, he got fired. Think about that. All right. I don't know if you ever read his commencement speech at Stanford. Changed the world. He got fired from his own company. What did he do? He loved what he did. I want you to love dentistry. I want you to make decisions that make you love dentistry so you can be amazing at it. That's the way I teach. Tips and tricks. You got to care. You have to have labs that are the best. You have to educate yourself, and you got to educate your staff. The office decor has to be beautiful, especially the bathroom. Digital, and think digital and everything you can. Post-operative phone calls for your patient. Sunday morning emergencies. Do you want your patient calling the service that's going to call the other person and they're going to call you, or do you want them calling you on your cell phone? I want them calling me on my cell phone. Dr. Dean is available 24 hours a day. That's an important thing. Notes for family members, notes for birthdays, announcements, funerals, babies, anniversaries. You got to have that all followed up. They will respect that and they will know that you care. Your patients are very important. So let's wrap this up. I want to let you know that in the last 6 years of my practice, I've seen an amazing change in digital technology. We are alive right now because of that technology. And I had a plan. And a lot of times the plans don't go as you plan them, but you got to keep going. You got to keep having the perseverance to want to be the best, to learn from the best, and follow the best. The people that are successful, those are your mentors. I'm happy to be yours. AIC Wall Street has done an amazing job of bringing technology together with education, with the young dental providers, because I think that's really the key. And you got to stay ethical and you got to stay consistent. The power of education is when meeting of preparation and opportunity generates what most people call luck. Not luck. It's being prepared and being in a situation that you have opportunity. You have to make that opportunity with education. All right, that's really the key. The key is having education to help you. At the end, I want to say goodbye. Staying comfortable is the enemy of progress. Think about that. Staying comfortable is the enemy of progress. You have to grow. Saying I'm comfortable, I'm doing okay is not what I think about. I think about how I can change. I'm going to be at the Greater New York Dental meeting on Sunday. If you'd like to come by, shoot me an email, text me. I'd love to meet you. AIC, thank you. We'll see you after the new year, Dr. Dean Live in January. And I'm putting on my scarf because I'm really, really cold. Thank you, everybody. It's been a great day. Hope you enjoyed it.